Hello, I'm Kara O'Donnell, and this is County Board Wrap-Up, where each month we take that in-depth look at the actions the County Board takes that affect us all here in Arlington County. Joining me today to discuss those key actions the board took at its March meeting are County Board Chair Matt DeFerranti and Board Member Takis Karantonis. Thank you both for being here today. We're going to start as we have, well, every month for the last several, and that is with the pandemic, specifically with the county's COVID-19 relief and vaccination efforts. Matt, I'm going to start with you. Give us an update. Where do things stand right now with the county's vaccination efforts?
Well, Kara, we have made progress over the last couple of weeks that is starting that ramp up that we have so long anticipated. And we're continuing to work. There are a couple of things. First, our number of doses went up significantly from around 5,000, give or take, to over 8,000, give or take. And so we're able to help more people this past week. We worked through some of the employee groups while we're also serving those 65 and older and those 16 to 64 with underlying medical conditions. So that's progress. There's also we're continuing to work through a number of sites, Lubber Run, Walter Reed, but we also have made progress over the past week and over the past month on equitable distribution of doses, which is a shared priority of our community and the board, as well as our county manager and staff. So we've moved forward on the partnership with Arlington Free Clinic, and we have a partnership with Neighborhood Health that is helping us get doses out to those who most need it in terms of economically and in terms of the parts of the county where we've seen the most cases. So there's significant work left to do for sure, and we're eager to get to that, but we're starting to see more and more doses with first doses above 20% of Arlingtonians, and we're continuing to work at it. So progress, not done, working on equity for sure. So that's a summary in part.
Let's continue that equity conversation a little bit. You mentioned the work with the Arlington Free Clinic and Neighborhood Health to really reach those uninsured, underinsured populations. But let's talk, I know, Takis, I've seen you and Matt, both of you out at some of the pre-registration pop-ups that we've been working on with our complete vaccination committee. For those who may not be aware of some of those efforts, can both of you give kind of a little bit of a intro as to what those efforts are and how they're going so far?
Takis, why don't you start? We both love going to these pop-up events because it's actually a sense that you're helping individuals one by one. And so, Takis, you start. I know I'll have a piece to add too.
And Mr. Chair, this is really very important. I have to add to your introduction, previous introduction. This is, as Kara has reminded us just a little while ago, this is a full year of doing these board wrap-ups and doing that in a virtual environment. So this says a lot. This is has been a very long year for our community, for everybody. And as you can imagine, those who are most vulnerable and are most exposed have been suffering the most. So going into more than a couple of dozen of pop-ups, and I have to say, the Complete Vaccination Committee has been absolutely critical to that effort because these are our ambassadors across the entire county in all hard-to-reach communities. It's not only the underinsured or infra-insured. This is a vast number of Arlingtonians who just doesn't have access for whatever reason to the main systems of registering people, putting them in line, and making sure that they get their vaccine as soon as possible. So it's absolutely critical that we have been, all our colleagues have been out there individually registering Arlingtonians one after the other, practically a door-to-door effort, and that has to continue, and it will be continuing. At the same time, I think also that we're ramping up also our testing efforts. I mean, we were very happy to see that now we can test with a mobile unit that will be going around and make sure that we get everybody tested and protected if necessary, and that we identify outbreaks as soon as possible where they may occur. The schools are opening. Life, is just pressing to get back to normal. But we have, and I believe, Mr. Chair, you mentioned that there is a presence of mutant variants. We have seen in the reports of our staff, of the director of our Department of Health of the district, Dr. Varghese, that the numbers of COVID incidents, despite the inoculation of actually more than 10% of the population right now, are still relatively high. The incidents, we keep the curve down, but we have still a long way to go. And equity is not only justice, it's also very good policy when it comes to epidemiology.
Sure. I'll just add really quickly, if you look at our positivity rate, it stayed under 5%, but I think our viewers will know that we have to keep we have over 20% with first doses, and we have around 10% fully vaccinated. So it's, in some regards, it's a little bit of a race. We want to vaccinate as many as we can, and we want everybody to just help us with 6 weeks, 8 weeks more of being really disciplined. It may be longer than that, but we're going to ramp up vaccines. And if we do, we'll see that positivity rate go down, and we'll beat this long year of response to the virus as a county, and also equitably with our populations that haven't done as well in terms of case numbers. So progress on COVID, much more to do.
And we are, as a community, all together in this. That's very, very important to stress. That is washing your hands, putting on your mask, keeping social distancing. Still, even if the spring blooms around you like the biggest celebration, we have to still, keep the fort. We will beat this.
Absolutely. And on that note, I know both of you have spent some time touring the various vaccination clinics here in Arlington County. What are you hearing from residents and employees that you've talked to who are getting their first dose, getting their second dose? I know I've spent some time in the clinics as well, so I know what I've heard, but I'd like to hear from you. What are you hearing from some of your constituents about their feelings about getting the vaccine?
Well, sure. Yesterday, I was at a pop-up in the Barcroft Apartments, and one person came up and he mentioned how thrilled he was and how he's sharing it with his family. And then he walked away, and 10 minutes later came back with a friend who he said he was worried about because the friend had some underlying health conditions and hadn't yet pre-registered. So he brought his friend back. And it was pretty inspiring because his friend said, look, I know I need to do this, and I'm thrilled to get to pre-register because I've been worried about this for a long time. So people have been upbeat, positive. I am not seeing so much vaccine hesitancy in Arlington. What I see instead is people not knowing exactly how to get to pre-register. And one big step we've taken this week is worked on a common form that could be used that makes it streamlines it a little bit so that Arlington Free Clinic, Neighborhood Health, Arlington County are all using something that is as easy as it can be while getting the key information to use. So pop-ups have been good, and I can tell you, I know it's true for you, Takis, they're energizing. So I don't know what your experience has been with your most recent pop-ups. You've been everywhere. I mean, I look at social media and then I'm like, he's in every part of the county. What's your experience?
Yeah. I've been hearing a lot, but what's the best is what I've been seeing: smiling faces, relief. And if I had to really highlight one thing, is I had to register people. I mean, it happened to register people who actually had COVID before. And it's not so unusual to bump on individuals who have had, who went through that. And, in a very low voice, I said, something, I've had this, and it is horrible. And these are personal stories. And this is it's twice the relief when, we say, okay, we will get you in the queue. We get more vaccine supply in. It won't take so long. Or neighborhood health is promising actually delivering, because it's a cyclical system. They sign up as many people they have supply for, and they say in 1 week you will be there, and entire families going into that. This is really a very, very good thing. And I have to say again, the volunteers and the staff, Cara here included, who have been manning the posts and womaning the posts. Week after week, they deserve the highest respect for their dedication. These are not easy logistics, whether it's a pop-up or a huge 1,500, 2,000 people in a day effort. This is, at the end, the work of individuals that are very dedicated and feel very strong about what they do. And I thank them for that, and I believe the entire board does.
And I'm just to echo what you said there, Takas, from my own experiences working in some of the vaccination clinics, those volunteers especially, we have everything from retired school nurses to nursing students to our fire and EMS and all kinds of folks who are volunteering their time to help with this vaccination effort because they just feel it's the right thing for them to be doing right now. And they are a critical part of the vaccination effort here in Arlington County. So I will echo that, and a hats off to all of them.